Hello, in this video, I'll try to answer any questions you may have about the ESTRING ring. If the video is helpful for you, don't forget to like the video and subscribe to the channel to support me. What is ESTRING ring, and why is it used? This medication is a hormone. It is used by women to help reduce vaginal and urinary symptoms of menopause. These symptoms are caused by the body making less estrogen. When treating only vaginal symptoms of menopause, products applied directly inside the vagina should be used first. Estrogens that are taken by mouth, absorbed through the skin, or injected may have greater risks of side effects due to more estrogen being absorbed. How to use ESTRING ring? Wash and dry your hands before handling the ring. Insert the ring high into the vagina as directed. The ring is usually left in place for 90 days and then removed and replaced with a new ring if treatment is to be continued. Do not leave a ring in place for longer than 90 days. Follow the dosing schedule carefully. If the ring is put in properly, you should not be able to feel it and it will not interfere with sexual intercourse. If you are able to feel the ring or feel slight discomfort from the ring, it may mean that the ring is not high enough. Gently push the ring higher with your finger. If the ring falls out of the vagina, rinse the ring with lukewarm water and put it back into the vagina. Contact your doctor if the ring falls out often. The ring is removed by hooking your finger through the ring and gently pulling it out. Contact your doctor if you have trouble removing the ring. Discard the used ring in the trash. Do not flush it down the toilet. It may take 2 to 3 weeks before you get the full benefit of this medication. Tell your doctor if your condition does not improve or if it worsens. Things to know before using ESTRING ring are as follows. Before using estradiol, tell your doctor or pharmacist if you are allergic to it, or if you have any other allergies. Do not smoke or use tobacco. Estrogens combined with smoking further increases your risk of stroke, blood clots, high blood pressure, and heart attack, especially in women older than 35. Tell your doctor if you just had or will be having surgery, or if you will be confined to a chair or bed for a long time. These conditions increase your risk of getting blood clots, especially if you are using an estrogen product. This medication may cause blotchy, dark areas on your face and skin. Sunlight may worsen this effect. Limit your time in the sun. Avoid tanning booths and sun lamps. This medication should not be used during pregnancy. If you become pregnant or think you may be pregnant, tell your doctor right away. This medication passes into breast milk. It may reduce the quality and amount of breast milk produced. Consult your doctor before breastfeeding. Possible side effects of using the ESTRING ring are nausea, vomiting, bloating, increased vaginal discharge, breast tenderness, headache, or weight changes may occur. If any of these effects last or get worse, tell your doctor or pharmacist promptly. Remember that this medication has been prescribed because your doctor has judged that the benefit to you is greater than the risk of side effects. Many people using this medication do not have serious side effects. If this video was useful for you, like the video and subscribe to the channel. Share your opinions and experiences about medication use in the comments section. I wish you healthy days.